In this video, we're going to talk about complications of sleeve gastrectomy. And again, this is the same conversation I have with my patients in the clinic. So, thinking about complications is with all bariatric surgery, think about the importance of vitamin and minerals, and is this procedure going to impact absorption? Sleeve gastrectomy is unique in that it can promote acid reflux, the satiety as well, because of you're making the stomach nice and narrow. It can also promote reflux, and so we'll talk about that. Other anatomic complications in comparison to the gastric bypass or say the satiety because of rerouting the intestines, and then lastly, its gut health impact. I think it's important to think about the satiety if that ends up being an option for you, as it being really a sleeve interposed with gastric bypass complications. You really get both. So with the sleeve, you don't technically get malabsorption because you aren't rerouting the intestines. And I think this is a big advantage, especially in the gut health picture. Native anatomy and function are left intact. You still make good acid production from the stomach. You don't make too much, you make just enough. But because the stomach is narrow, it can lead to reflux. So it's really due to the shape of the stomach and whether or not a person has lost adequate weight. It also relates to how well you're abiding by not eating and drinking at the same time. So we recommend when you eat a meal, waiting at least 30 minutes before you start drinking fluids. That way you're not mixing fluids with food. You need to wait for the stomach to start to digest its food and open up the pylorus, which is the muscle at the bottom of the stomach, so that the stomach can be emptying before you start drinking. If you eat and drink at the same time, pylorus is closed, it's just going to backfill and you're going to find yourself vomiting or getting reflux. There's other anatomic complications to consider, but they're far different and less severe than, say, ulcers, strictures, or internal hernias. For example, your surgeon might make your sleeve too tight or narrow for you, and that can result in a different type of stricture. Also to note here is it's easier to get a hiatal hernia. I see this a lot in my practice. We do bariatrics. We give somebody a sleeve, and a hiatal hernia, the hiatus is just the opening in the diaphragm where the esophagus and the stomach kind of meet. And what's normal is to have a little bit of esophagus and your whole stomach below the diaphragm. When somebody loses weight, maybe they've had a baby, or maybe they just naturally have stretchy tissue, the diaphragm, that opening can kind of widen and gap. And it's so easy for a narrow sleeve to then just slide up a little bit. And it doesn't take a lot. A centimeter or two of stomach up in the chest can really make the difference between a competent, closed lower esophageal sphincter and an open, floppy kind of one. So sometimes after a sleeve, even when people are doing everything right, they can experience pretty significant reflux. They can't lay flat, even if they're, changing or doing everything perfectly right with their diet, they just really can't get comfortable. And sometimes we have to convert those people to gastric bypasses. Same thing goes with the satiety. If the satiety, because of the sleeve, is experiencing severe gastric bypass, you might have to consider switching them back to a Roux-en-Y. So bariatric surgery can get really complicated, which is why in our practice, we like to really give you, the consumer, as much information as you possibly can. Risk versus benefit. What are your options? What are you most comfortable with when you make your decision for which surgery is right for you? The gut health impact from a sleeve gastrectomy perspective is much less severe than the bypass or even the satiety. With the gastric bypass, remember, you're not getting as much stomach acid. With the satiety, you are. With the sleeve gastrectomy, you're not rerouting the intestines. You're getting relatively normal amounts of stomach acid. However, if you're one of those people that ends up getting acid reflux after surgery and your doctor or provider puts you on an antacid, well, the antacid can help mitigate the symptoms of reflux. It can lead to SIBO problems down the road. In fact, many people who come to me, they're already on antacids. In my professional opinion, antacids are best used when you're healing an ulcer, but not for everyday kind of reflux. But that's probably contentious among many different types of providers. So a little disclaimer here, make sure you're having these individual conversations with your surgeon, with your provider. Some of you on this call or in this course may be going abroad for surgery. And so just make sure that you have all the information available to you so you can make the most informed decision. We're going to talk about how you heal SIBO or how you work with the anatomical changes that create that microbiome disturbance in our gut health and metabolic surgery video.